or almost afternoon, still morning. We are so glad to have all of you with us today for this this special edition of the Coalition for Affordable Housing and Transit's monthly meeting, combined with Representative Zach Hawkins' Durham Housing Authority town hall. And I'm Becky. I'm Becky Winders, a member of the coordinating committee and keeper of the coalition's mailing list. And so if any of you are not on the mailing list and would like to be, just send a request to rmwinders at gmail.com. I'd like to give a special welcome to Representative Zach Hawkins, who is our representative from District 31, East Durham and Southeast Durham, to the North Carolina House of Representatives. And we are very indebted to Representative Hawkins for having this series of housing Durham Housing Authority town halls that I hope are giving the community a chance, housing community residents a chance to get all their issues out and get their questions answered. And I hope that it's my fervent hope personally that we're going to get a greater understanding out of this of what situation the residents are in and what constraints the administrators are in, and we will be able to move forward and do something in the short run that until we get the long run solution is new houses, because these apartments were built in the 1950s, I think, are new or totally upgraded. So, but we still have the current situation to deal with. So Representative Hawkins is going to be a moderator along with Larissa Seibel, who is a member of the coordinating committee and every other organization that deals with affordable housing in town, I believe. And I'd also like to welcome our speaker, Anthony Scott, who has been kind enough to join the coalition several times in the past and has patiently answered hundreds of questions. But I will now turn the meeting over to our moderators for this week, this month, Representative Hawkins and Larissa Seibel.
Larissa, I'll yield to you and I'll go next.
Thank you, Representative Hawkins, and thank you, Becky. My name is Larissa Seibel, and I'm one of the moderators along with Zach Hawkins on the questions. But I do want to first apologize. I had not communicated well with a couple of other speakers that we had hoped to join us for this coalition and DHA town hall meeting, and we hope to work that in the future. I apologize for that miscommunication. And I want to turn things over to Zach Hawkins.
Yeah, thank you so much, Larissa. Glad to moderate with you. Couldn't think of anybody better to do this with outside of Stella Adams. But I think the opportunity to continue this conversation is something that I have shared that I'm dedicated to. I want to thank Anthony for, again, the hundreds of questions that he has answered. I'll even thank you for the hundreds of questions you will answer in the coming months. Because we're dedicated to making sure that safe and affordable housing in Durham is not something that's hopeful, but things that we will actually see. And that comes with community conversations. We can't totally lay this at the feet of our residents. A community has to come together and do that. So thank you to the coalition and so many others who are willing to join in this work and do that together. I do want to also insert, my apologies. One of the reasons that we decided to do this is because the regularly scheduled DHA town hall and this meeting were close in proximity. And so we wanted to be efficient. We wanted to make sure that everyone got a chance to participate and not be redundant at the same time, because we see a lot of that happening in community work. And so this was the marriage of that, to have this here. I think it's a great platform. One of the things that we're going to do is we're going to take this, we're going to share it out amongst all of our social media platforms, to our entire listserv, so that people can go back and listen to this discussion, and then hopefully work with Anthony to continue our remaining calls, and maybe even a special one, just to make sure that any gaps that need to be filled get filled. But the commitment is to the community, and making sure that safe and affordable housing is something that everybody can enjoy. So Anthony, we've done this quite a few times. And so I don't know if you need any introduction, but Larissa and I, after you get started with your opening remarks, are glad to start the question and answer period for those who are with us. Thank you.
Great. Thank you to the coalition and to you, Representative Hawkins, for again giving an opportunity for a forum. What I've done is there were 5 questions that have come before me. So I have a relatively short, just kind of presentation just to kind of answer those that I think might help in some respects. So give me a moment.
And people can put questions in the chat now. So go ahead and do that while we are waiting.
Great. Can everybody see the beginning of the presentation?
No.
Oh,
No?
only on your
Yes.
screen, not.
Okay, let me back out and try to do share screen again. Okay, how's that?
Perfect.
Yes.
Okay, great. All right, so again, thank you all for this opportunity to come before you again. And what I put in the bottom left corner is like a Q 1, 2, 3, 4, 5, which lets you know which question slide is addressing, because some of them are sort of interrelated. The first question, and actually I can't see the question. If Larissa, if you could maybe read the first question.
I'm sorry. We asked you to update us on actions that you have taken in 2021 regarding residents of public housing, concerns about communication, repairs, eviction policies, relocation, as the transition goes from public housing to other types of housing. And my
Right.
screen now, I can't see the rest of it, but that's
But
plenty
yes.
right there.
That's fine. And so even though you asked from January until now, I thought it was important to give a little bit of context, because we started back in September around one key area, which is addressing staffing, because that has been a factor in two ways. One, there have been complaints about staff and what they were doing and how they were doing it. And then 2, having staff vacancies that were very challenging for us to fill. So back in September, we sort of redesigned our recruitment, our interview protocols, and secured some relationships with temporary agencies to do some backfilling. And then from November to December, we brought in a HR consultant, and that consultant has been working with us to complete our assessment of all of our property management staff. And this assessment was based on the National Center for Housing Management Standards, which is a nationally known organization that goes back to, I think, the 70s. I believe I was reading a history on this. And then in this year, between now, January and now, we've completed the testing, we've evaluated those results. And based on that, we are conducting training. I believe we pretty much have finished all that. And then this month, we're doing our assessments on what the results of that training have been. With respect to public housing repairs, just to give you an overview of what's been happening on the work order side. So we have had almost 4,000 work orders open from January and through the end of April. We've closed almost 4,000. You can see the difference there. It's only a few. And we currently have a backlog of about 890 work orders. That backlog is not the same work orders from January to April. That's, some work orders have moved to that backlog category. Other backlog work orders, you see at the top, we had 828 starting. So not all 828 that you see in December 31st are the same as the 890. Some of them are, but quite a few of them have been closed out. So we are continuing the ongoing battle of work orders coming in versus work orders we're able to complete in a given month. And one of the ways we're looking to address that backlog is we have been hiring temporary staff to fill those back open positions. We hired contractors to assist us in addressing the work orders. However, we halted a lot of that work because of feedback we were getting from residents. And I'd like to thank our residents over at Hoover Road for being able to help enlighten us on a few things. And so we halted that. And we then did a new RFP to recruit new contractors. So we were successful in completing that procurement. However, we only got 3 bids. One of those, which is a licensed contractor, the other 2 are not. But we don't necessarily need licensed contractors for every bit of work that's being done. So we're evaluating those other 2 proposals as well to see how and if we are going to be able to use those. And meanwhile, we're going to continue to recruit additional contractors to be able to help us in our backlog and get us caught up. With respect to our work order system, and this is question 3 that asked about what and how does our work order system work? Residents call in work orders to their respective management offices, and those work orders are prioritized in 3 categories: emergency, urgent, and routine. Emergency work orders are those work orders that must be addressed within the 24 hours. They include something such as, a water leak or some other extreme emergency. And then there's a process. There is not a process in which to use to monitor the work orders per se, but residents, when they call in those work orders, they are given a work order number, so they can call and check to see the status on a particular work order based on that work order number. But we've also acknowledged that we received numerous complaints that work orders weren't being entered in the system. Therefore, when residents called, they're not actually given a work order number, so it's difficult for them to track. Or that they weren't necessarily given a work order number, but then the work order, just was never completed. So one of the things that we've done is we've procured, this isn't complete yet, but this is a procurement of a third-party single call line for work orders. So this should be ready to go by June. We've done the procurement. We are almost complete with the evaluations of that. So we expected that to be in place in the month of June. And this will ensure that through one phone number, 1-800 number, then all residents can call that number. They should be given a work order immediately as a result of that call, and then they will be able to track that better. And most critically, DHA will be able to track that better. We won't have the concern that work orders have been called in, but they haven't been properly entered into the system or some other kind of issue. Question 1 and 4, which was related to both rent collection and a proposal by Durham CAN. One of the things that we've been able to do is just, I believe last week or maybe the end of the week before, we were able to hire our housing specialist team members. And these will be individuals whose job it will be to reach out to our residents directly who are behind in their rent or late in their rent, and work with them to assist them in any way they can, whether it be referrals to Department of Social Services or ecumenical organization to help them if necessary for whatever's going on with their ability to pay, and or to work with them to work out a repayment agreement. Repayment agreements are something that's been in place at DHA, and we actually re-emphasized this in 2019, in August of 2019, indicating to residents that if you're having trouble paying your rent, let us know so that we can make payment arrangements with you. And that could be up to a year in those payment arrangements. And this is a process that we implemented in 19. And we want to continue to try to promote that, and the housing specialist team that we're bringing on board will be able to have that direct connection with residents and outreach. And the other thing is that they're not tied to a management office. They're going to be agency-wide. So this would give hopefully residents a little more confidence in engaging with them, which has been some of the challenges that we understand to be the holdup with some residents being able to come forward and deal directly with our property managers. So within the next 2 weeks, I skipped one. We've also met with the Department of Social Service to determine how the emergency rental assistance program will work, which they just announced last week. They finally rolled it out. We've had several meetings with them about that so that we can make sure that we can coordinate with our residents in any way possible for the application process. And within the next 2 weeks, we will be including information on the Emergency Rental Assistance Program, or ERAP, in the rent statements that are going out. We'll also be posting flyers. We'll have information on the DHA website. In fact, that'll go up today. And again, we'll be utilizing our housing specialist team to do outreach to eligible families and help to direct them to the program at DSS, other organizations that are helping residents, and/or DHA itself will be able to assist those residents. And then lastly here, Durham can offered a proposal that indicated that we should wait 90 days before we will file for an eviction. And this is a proposal that we're looking at. We're particularly looking at it based on what they, in terms of where they got it from, in terms of Winston-Salem housing authorities. So we've been in discussions with them to try to understand how their program works better. Meanwhile, we're going to continue on with our housing stability specialist efforts and our efforts to get folks to do repayment agreements. And of course, with respect to now, because we're in the moratorium and we know that there is a rental assistance program that has funds available, we're going to work with each and every resident to make sure that they can apply for those funds, for all funds that they're eligible for, and then work with them in terms of doing a repayment agreement for any remaining funds that don't necessarily qualify for that program. Question about resident services and what kinds of efforts have they made in this from January until now. This goes back to question 1 again. So from January 2021 to now, we've continued to work with residents on food and nutrition programs, particularly with our seniors, but families as well. We've coordinated testing at 4 DHA sites for COVID-19, and we've also coordinated to actually have vaccinations at our DHA sites. In addition to that, we partner with other folks such as Duke Health and the Department of Health, in making sure that anyone who's looking to get a vaccine can get either transportation or know specifically where they can go. That's ongoing with our resident services team. We conducted a virtual job fair. The Ross and FSS programs have 131 and 126 participants currently, and that is continuing. And we're really excited about our Jobs Plus program, which is exclusive only to McDougall Terrace. And that's not DHA's doing, but that's just the qualifications of the program. And we're now up to 71 enrollees in that program. And in short, what it is that it is a program that encourages residents to get employment. And the best part is, most of you know that for DHA, your rent is based on 30% of your income. So if your income goes up, then your rent will go up, up to 30% of whatever you earn. If your income goes down, then your rent will go down. Again, reflecting 30% of your income. With the Jobs Plus program, though, if your income goes up, which we're encouraging folks to get employed, and we're providing some services and partners around this, your rent will remain the same for a fixed period of time. I believe it's either 1 year or 2 years, and then it steps up a little bit, but it doesn't exactly correspond with a certain percentage of your income. So it's a really, really great program. It's a $2.3 million grant over 4 years, and we're very excited about the continued enrollment that we have that's going up. And I believe that's one more. Then the next question on resident councils, question 2, was asking about how DHA is assisting in working with our resident councils. So our resident services office is primarily responsible for working with the existing resident councils that we have. So there was an effort over the last 2 months, that is March and April, to reach out to the leadership at all of the various communities. And they arranged for meetings to happen both in March and April. Although the attendance was sparse, they did discuss the importance of the resident council, answered questions, talked about the idea of doing future elections and recruitment. And now that we're seeing some easing in our distancing and masking requirements, but primarily distancing, we are going to be doing some in-person outreach, and that is scheduled for the 3rd week of June. And it's going to be community by community rather than doing everyone together, but literally going out to the various communities to try to recruit new members and setting up elections for all of our DHA communities to hopefully get new blood to go along with the existing blood at our resident councils. And I believe one more. Question 5 was asking about what are our communication efforts. We always post things on the DHA website, and this is primarily handled by resident services. I should say these other areas are handled by resident services. So Facebook, Twitter, Instagram, emails, flyers, calls, text messaging, all of those things are pretty much handled as outreach by our resident services team. I should mention that we have recently brought on a company that allows us to do kind of alerts. Almost, you think about how Durham has an alert Durham system. Well, we now have an alert DHA system. And so we are currently now putting the contact information of our residents into that system. And you can pinpoint a community, or you can do all of DHA properties. And this is a way that we're looking to hopefully communicate with some of our residents around very specific things. We're going to be careful though, because we don't want to, inundate people with a ton of sort of these text messages about every single thing that's going on. But for select things, we will be using this system for those who opt in. And I believe that is my last slide, and I will turn it back over to you all.
Good. Larissa and I will tag team this portion of it. Thank you, Anthony, for that. That thorough presentation and answering of the pre-submitted questions. Just a warning, you may have to go back to some of those. So practice on the share screen. I want to get started. I'll go back a little bit here and start with Nora Smith from Peach. This is a statement that she wants a response to, and it says, I would like Mr. Scott to address how and if repairs are being completed in recognition of the fact that some public housing was built before 1978, and some properties are found to have lead-based paint hazards. What is being done to assure residents, especially children, are not at risk for lead exposure due to repairs completed in the units?
Right. So, I got to thank Peach for bringing some of this to my attention, because initially when I came to DHA, I was informed, and we had actually had some documentation that showed that we had lead-free properties. And some of the work that, and particularly Larissa, who's been the one that's reached out to me the most, we found that no, we don't have lead-free. We had lead-safe properties, which means that the lead paint, it's been primarily paint, has been properly remediated. But that is a remediation that requires certain upkeep. And that's where DHA has not always done a good job of that. So as we're looking at doing these repairs, we're requiring our contractors. And let me first back up and say, we're doing an effort now for our what's called our capital work, which is a separate pot of funding we got. We spent a great deal of that for the McDougal Terrace crisis. But with our capital planning, we are, as a priority, is going to make sure that we are dealing with all of our units that have lead-based paint or other lead-based exposures, or lead-based exposure, to make sure that we can actually address that. That's going into this capital plan that's being formulated now, and it's for all of our properties, but in particular around the lead-based exposure, it's going to be at the top of our list.
Lenora, if you're on, is there a follow-up to that? Or did that answer your question? Okay. All right.
I am on, thank you. And yes, that is helpful information. I think that for the apartments that have been identified with lead-based paint, I would also suggest that, there be some type of intervention for those families so that they're not in position to be exposed to any lead dust or lead paint in or near their property. So for those that have been identified, I would just ask that some action be taken for those properties. Thank
Yes,
you.
and in fact, I will circle back with you because when I've gotten those reports from Larissa, the property management staff was instructed to do that, but let me just make sure that we coordinate our list on that. So if you could reach out to, if you could put your info in the chat, and Tuan, can you make sure that you get her contact information, please?
Okay, thanks.
Larissa?
Yes, so the next question is related to repairs also. I had two similar questions, one from Stella Adams asking that all work orders be tracked, and then from Faith Gardner, who works at the City Neighborhood Improvement Services, asking if the Neighborhood Improvement Services code enforcement cases were reflected in the work orders backlog, or are they only generated by residents?
So to Stella's question, yes, the work orders are supposed to have work order numbers. Once they go into the system, they automatically get a work order generated, a work order number generated. And to Faith's question, yes, that is in fact what happened. That's why you see, well, if you look at our report, you'd see that there's a large number for McDougal Terrace, and also for Hoover Road, which doesn't include NIS. We did an independent inspection of each unit, and there were 297, I think, work orders that were generated from that, and those were also put in the system. That's one of the reasons why that backlog number is still so high. That's why I was emphasizing that the number we had at the beginning of the year doesn't necessarily reflect the exact same work orders, but we did input the work orders from Hoover Road, and we incorporated the work orders from McDougal Terrace.
Good. Thank you for that. This is another question from Stella Adams. It's referring to the housing specialist that we talked about in previous town halls. And so her first question is, how many house specialists were hired? I'll go question by question if that's okay.
Sure. There were, it was originally going to be one position, and then it expanded to two, but now we have three because of the work on the emergency rental assistance program. So there are three people that have been hired for that.
Okay. Second, the follow-up to that is how many of them are DHA residents?
At least one is a DHA resident. I don't know about the other two. I don't think the other two are, but at least one is.
Okay, and then the last question of that series is what Section 3 efforts were made to hire residents for these positions?
Well, again, we did get at least one DHA resident who is a part of that. And as far as the outreach beyond that, we simply advertised the position.
Okay. And a follow-up for us related to that is I know that you put a lot of the information on social. It may be good to know from people on this call how we can assist in making sure that we get that information out as well. But that's nothing to respond to, it's just a statement. I'll pass it back to you, Larissa.
I have a couple of questions in the chat related to the COVID pandemic. And one is about the prevalence of people who are testing positive in public housing communities, and also some idea of people who lost their jobs as a result of COVID-19. Do you have anything you can share publicly as to how folks are doing in public housing?
I don't, because that's all, basically covered under HIPAA anyway, because that's essentially medical information. So we know anecdotally, we've had some folks who tested positive, particularly in where you have a single apartment building kind of thing. So that we were making sure that we stayed very close contact with the health department on that, so that we can make sure that we reemphasize the protocols and policies that we put in place. But when it comes to our larger family sites, it's much more difficult to track that information, because that's literally information between a resident and their medical provider. So we don't have that information.
Well, let me ask a slightly different question. I know that you mentioned the emergency rental assistance program, which is available to everyone who's been affected by COVID in terms of loss of job or income. And that I believe a number of people in public housing communities, like other folks, lost jobs or had to stay home to take care of children when schools closed. So do you have an idea of numbers of people who you expect to be able to assist with the emergency rental assistance program?
Well, I can tell you that we have almost 700 families that are behind in their rent at this moment. And we are assuming at this point that all of that is COVID related. We won't know differently until we actually engage with those residents. That's why it was important for us to try to understand how the rules worked. That's why we met with DSS on a couple of occasions. And so we're doing two things. One, we're just making the information available, but two, those housing stability specialists are going to be reaching out and making sure that they can direct those residents to the assistance that's out there, DSS being one, but also there's a number of community organizations that are a part of that DSS outreach. And the key thing we learned is that the proof that is needed for whether or not your reason for being behind your rent is not as stringent as you would typically have to deal with when it comes to dealing with HUD or Treasury and any of those guys. So there's a great deal of flexibility in how you define the impact of COVID to your household. So for example, it doesn't have to all be job related. If you had to incur other expenses, for example, childcare or something like that because of COVID, that doesn't necessarily mean you've lost your job, but you might have other expenses associated with that. Those are all applicable COVID-related cost increases that would allow you to have eligibility under the program. So we want to make sure that we can connect our residents either through us or through those community organizations that are partnering with DSS to help them understand how you actually qualify. It is not necessarily all income related, but it is expense related.
Right. And that's very helpful information for everyone on the call to understand that this is available to anyone who's a lower income person who had a hardship, either loss of job or income, or they had high expenses or something happened during COVID. I appreciate your spreading the word. I'm going to hand it back to Zach for the next questions on jobs programs.
Yep, sure. Thank you. So Anthony, you gave a lot of good information about some of the efforts, the virtual jobs fair and the Jobs Plus program. And so there are just a few follow-ups that were sparked by that. The first one I'll go with is from Regina Mays. She said, can we get a number of how many residents were denied to participate in the ROSS, FSS, and the Jobs Plus program, if you have that information? So we know who was accepted into the program or enrollees, but how many do we know? What's the percentage or the raw number of those who were denied?
Yeah, unfortunately, I don't have that information off the top of my head at all, but I could certainly follow up. Okay. I'm actually getting a message from one of my staff people, and I said, no one has been denied. So.
Okay. Well, good to know. Thank you. Thank you for that. The question related from Stella talks about the efforts being made to broadly conduct resident skills assessments so that residents can qualify for any jobs, but specifically these Section 3 jobs. Do you all participate in any of that skills assessment building?
Only through, I would say, only through the program at Medieval Terrace. But beyond that, we don't really have a way of doing that. We don't have the staffing for it at this point.
Are there any particular partners that you think could help with that effort in Durham?
Well, we do have a partnership with Office of Workforce and Economic Development, and that is a way to do that, but that has been specific around construction-related jobs. Because of the work that DHA is doing, we've made a commitment to make sure that for all of these hundreds of millions of dollars of development work that's going on, that we want to make sure that we can hire our residents and community members for the available jobs, and to make sure that we have local contractors and subcontractors that are getting hired for that work. But outside of that, we don't have a particular partner in mind. But if there are recommendations for that, that will be great, and we can connect them with our resident services office.
Okay, fantastic. Well, I'm pretty sure everybody on this call has connections, so please put that in the chat. Back to you, Larissa.
All right. I have a question related to the resident councils, and it's from Dr. Sonia Laurie. Which DHA communities currently have operational resident councils? And I do want to add one thing, is that there are still community leaders out there working really hard through COVID, supporting other residents. And I do want to recognize that, community leaders are, whether or not those are so-called operational resident councils, according to DHA, I hope that you can address that question and also speak to what you are doing with resident leaders now.
Mm-hmm. So the list of communities that have resident councils, or at least partial resident councils, is Duval Terrace, Hoover Road, Forest Hill Heights, Scattered Sites, 519 East Main, Oxford Manor, and Club Boulevard. Those that do not currently have resident councils are Liberty Street, Cornwallis, Laurel Oaks, and Daymar Court and Maureen Road, although I know they have some active members there. I'm sorry, there was another part to that question.
Yes, and so what are you doing now and going forward to make sure that all of the public housing community resident councils are supported, by DHA? And what's that process look like and time frame?
Right, so that goes back to what I spoke about a little earlier, where there is going to be outreach, and starting the third week of June, Resident Services Office is going to be going out to the communities directly in person. The virtual format wasn't as fruitful. So now that we have some eased restrictions, there's going to be person-to-person kind of outreach and communication to try to make sure we can get more people actively involved, and that will gear us up for an actual election.
Okay. And I'm going to invite both Dr. Laurie and then Stella Adams, who has a similar question. If Dr. Laurie, if you have a follow-up question, and then Stella had a question about working with DHA residents councils with maybe other community-based groups like Durham's Tenant Union. Not having DHA be the only connection. It's if there are community groups that are involved or want to be involved. And so I want to ask Dr. Laurie and then Stella Adams to speak.
Thank you. Thank you, Mr. Scott, for your time, and Ms. Seibel and Mr. Hawkins for moderating. I guess I'm just curious about what it means to be a resident council as opposed to independently organizing folks within DHA properties, and what kinds of resources DHA is providing to the resident councils that are currently active.
So all resident councils get a, I'm going to call it a financial support, excuse me, it's based on the number of units per community, and that's based on HUD regulation. And I believe it's $15 per unit per community per year. And so that's the financial support that DHA offers, and that is for resident councils per HUD guidance. So I'm not sure about the question versus resident councils versus outside of resident councils, because the resident councils are the recognized body that represents any community. And also, just to clear up for anybody who may be thinking that the resident councils are controlled by DHA, they are not. They are, DHA tries to support them, but that's one of the challenges, is that we cannot have a direct hands-on role, because there has to be sort of an arm's length relationship between the councils and DHA. So the elections are completely done, by residents in terms of the voting of who gets to be on the council. They're not appointed, but they are supposed to be elections that happen from those particular communities. We just try to support meetings, if they want meetings, where they'd be located, any information or material they might need, and making sure there's a space to try to meet those sorts of things. But we don't get into the business of how those councils are run or operated. We are not even invited to we don't attend the meetings unless we're invited. And when the RAB was more functional, the Resident Advisory Board, which is made up of all of the resident council presidents, I was meeting with that Resident Advisory Board each month when they had their meeting, but I was only meeting as an invited guest. So I would come at a certain portion of the meeting to discuss any issues or questions that they might have. And then I would dismiss myself from or they would really dismiss me from the meeting. So it's the same thing with resident councils. They are to be controlled by the residents and not in any way by DHA. So we would welcome opportunities for others to get involved. In fact, several years ago when I first got here and looked at the state of our councils, Durham CAN was the organization that actually reached out to and said, hey, can you assist in organizing our resident councils? And that was one of the efforts that were put out there, because one of the challenges is finding organizations that do organizing so that we can help support those councils. We have this tricky kind of place because we can't dictate or direct, but we want to support. And sometimes that gets a little hard if you are being perceived, or in fact, in reality, you are the landlord, and they might want to have something to say against you. They might feel like they can't speak openly and freely. So we try to make sure that we keep that line so that residents can feel free to meet on their own, talk about issues, and then bring those issues to DHA.
Thank you, Mr. Scott. My last quick question would be, my understanding is that currently at Hoover Road, Oxford Manor, and Club Boulevard, those resident councils have a single member. Are there criteria per se for what the composition of a resident council looks like on DHA's side, or is that again kind of determined by the residents themselves?
No, there is a particular structure around councils. First of all, they have to be elected by the residents of that community. There's I believe it's president, vice president, and secretary that has to be an officer of that organization. And that's pretty much it.
Okay.
Stella,
Go ahead, Zach. But I had recognized Stella Adams, but Stella, do you need to follow up or?
Yes, I just want to follow up for informational purposes and to encourage particularly where we know there are sort of unincorporated residents councils. There's groups of residents that are acting in support of their communities, that we provide them as a community with guidance on how to establish their formal residence council is critically important. I think the Durham Tenants Union would be an excellent place for that education and for those elections to take place. I think CAN is also another organization that is proper, that has the respect of the residents, and particularly the unincorporated resident councils and leadership in these communities that can help them organize so that they can take control of their communities, establish their councils, get the resources financial that they're entitled to, get the programming that they're entitled to. These are not wish lists. This is not something DHA hands them. They're entitled to it. But you don't know what you don't know. And you can't organize if you don't have organizers helping you. And DHA cannot organize these councils. It's not their function. It's our function as a community to help these residents. That's all I have to say.
Thank you for that, Stella.
Well, thank you so much for that exchange, Sonia and Stella Adams. Larissa is going to continue with the remainder of today's Q&A. I do have my colleague, Vanetta Alston, and she's available at the end to talk about our commitment and some of the things that are happening in General Assembly around affordable housing. I'm lucky enough, I'm going to join Governor Cooper for a bill signing of a bill that I've been working on in the General Assembly here at 1 o'clock. But thank you so much for this. I cannot wait until our next one, be it special or on our regularly scheduled time frame on the second Tuesday in the evening, so that everyone can participate. And we continue to make sure that there will be a commitment to ensuring that residents and resident leaders are participating in these. But this is important. So thank you, Anthony Scott. Thank you for the coalition for this collaboration. Hopefully we can do a lot more of it. Take care. Have an incredible day.
Thank you.
Thank you, Representative Hawkins. We're going to get back into the questions. There's some really great questions. I hope we can get through them in the next 10, 15 minutes. We'll leave a little time for Vernetta Alston, Representative Alston also. There were some additional questions. Okay, recognize, yeah, there are some similar questions I think we covered with the resident councils, but a really important subject. So someone asked about resident services team going out to knock on doors about those specific programs. I believe they responded that they do that with the programs, and that they utilize all other forms as well. But I know I was out in one community where there was some door knocking done by DHA. Okay. But if there's, if you want to respond about a question or a statement by Jenny Loom, that some of these resident council leaders who've been carrying on through COVID are really filling the role that you would think that the property managers would fill in terms of programs and assistance and communications with residents. Can people who do that kind of work get paid?
We don't have a budget for that at the moment, and it's something we can try to look to see if we can maybe raise some funds for, or maybe there's some program dollars that may be able to be done around that. But it's a community effort all the way around, and it's not going to be something that DHA can do on its own. We do have kind of weird restrictions with our funding in terms of what we can do and how we can do it. But one of the areas that I've always talked about is particularly around organizing and resident councils and things like that. I think there's probably grant funds that can be applied for and won. And this is one of the things that when I first came to DHA, I talked about with the Resident Advisory Board. Some of our councils, I believe, are actually already 501c3s. And it gives them the opportunity to actually go after grant funding, whether it be philanthropic or via a foundation, or philanthropic via perhaps corporate donations. But I think that's something that we certainly would like to see happen, so that we can give more support to our resident councils.
Okay. And one other related question in terms of space for resident councils to meet. I had heard from at least one community that the meeting space was shut down during COVID. Are these available now for the resident councils to meet?
Not as yet. We are looking at what our protocols are going to need to be. Obviously, the changes just were announced last week. And so we have to kind of put our heads together around what does that mean. We still have a lot of concerns We haven't even moved to the point of us fully opening our offices yet, because we still need to work through some of these. As you know, there's been quite a bit of controversy around the CDC's lifting of not sanctions, but the lifting of their protocols. So we have to think this through carefully and make sure that this is still going to be something that can help keep our residents safe. So we have to figure that out, and then we can figure out how we can do that in terms of the number of people that we can allow in a particular space. But some of those spaces are relatively small and all of those sorts of things. So that's next up for us, is to figure out the use of those spaces and the appropriate protocols around that.
Great. And Joellen Mason, who asked that question, also said, if they need space to meet, can we help with securing monthly meeting space to be donated by local companies or nonprofits? And that sounds like something to consider. Joellen, I hope you're with a group that will offer that assistance to resident leaders. And I think you can get the list from the resident services who are on this call.
Okay, great. Thank you.
Let's see. So I think we're getting down to the end. In the CAN proposal concerning eviction prevention, Jane Williams says the second request would be there would not be an eviction filing without direct contact with the resident. So are you saying that the new eviction stability specialists will have to make contact with those who are behind in their rent before a filing is made? That's a question for you, Anthony.
Yes, that's what we make contact with residents now, but certainly with the housing stability specialist, that is exactly what their primary objective will be.
So those were 3 additional housing specialists covering what, about 9, 10, how many communities is that? Or is there 1 in each office at least?
No, there's not 3 additional. These are new positions that have just been created. And remember, their primary focus is around those residents that have been late in paying their rent. So they don't have to necessarily think, you don't have to think in terms of every single household has to be contacted, but those who have been late in paying their rent, they will be reaching out to those families to try to determine what's the cause of that, how might DHA help, do we need to do a repayment agreement, are there other sources that it might go to, such as DSS or some of the churches that are helpful. It's that process.
That's a lot of people for 3 folks to help, but I know there are also those other community agencies you mentioned. You're referring people to those as well.
Right, so the 2 different things here, right? One is dealing with the emergency rental assistance program, and one is sort of normal life, right? So these specialists we expect to have in place beyond sort of dealing with this immediate need. There are other staff that we are looking to bring in on a temporary basis to deal with the emergency rental assistance program. But these specialists are looked at being permanent positions that will last well beyond us addressing the existing emergency that we have with the COVID-19.
Okay, great. Are there any questions? If you want to unmute to ask any more questions, we'll spend a few more minutes with Mr. Scott,
have a
and we want
question.
Bernetta to speak next.
May I ask a question?
Yes, ma'am.
My question, I'm Rosa S. Anderson. How are you doing, Brother Scott?
I'm doing well. Good to hear from you.
My question to you, I've heard you with these conversations before. I heard all that good stuff. How are you feeling about what's going on? I just want to know, what are you feeling?
Well, you know, we have a significant challenge with respect to our labor pool. And when you look at what's happening in the Triangle with private sector development, things like that, it's been a major challenge for us to get quality staff in place. And given that we're behind, we don't have the luxury of some of the things that we would like to do, like, you know, developing our own training program and things like that. We've got to deal with the immediate issue. So it's daunting. I'm optimistic about the progress we've made with some of the work around procuring the call center, procuring, you know, contractors, those sorts of things. But it's not going to happen fast enough for me, and my staff will tell you how impatient I am.
Right.
You guys have no idea, but
Right.
it's not going to happen fast enough for me. But I am encouraged by progress that seems to be on the horizon.
Right.
And so that's the best I can offer in terms of how I'm feeling right now. So
That's important. Thank you so much.
you're welcome.
Well, now I would like to recognize Representative Vernetta Austin to say a few words and make her announcements.
Thanks, Becky. And hi, everyone. I didn't plan to speak today, but happy to. We just finished crossover week last week. Last week, I did have a bill pass the House to study the affordable housing needs statewide in North Carolina. It was a bipartisan bill. Glad that it's passed. It'll be a study with the Legislative Research Commission, and my hope is that once that study happens, hopefully with a lot of great stakeholder involvement, we'll have some good study bills to file kind of in the next couple of years. So obviously it's an important issue that's always been at the forefront of things here in Durham, but I think folks, particularly because of the pandemic, have recognized the importance of this conversation. So very happy to have had that pass in the House. It's now over to the Senate. Encourage you to reach out to folks on the Senate side to support that bill. I also filed a couple of other housing related bills. One was a pandemic eviction protection bill to help folks, renters who were significantly impacted financially by the pandemic, to have their records sealed if they're subject to an eviction during the state of emergency, and also to generally, regardless of the pandemic, create a pathway for eviction expungement for anyone who's had an eviction filing, or for most folks, excuse me, who have had an eviction filing. And then also I filed a local bill related to housing as well. That said, just in terms of housing updates, there were a number of bills that were filed by largely Republicans that would have, kind of limited and kind of chipped away at the ability of local authorities to, kind of make the decisions that they need to make with regard to zoning and land use. I opposed all of those bills, as did most of my colleagues on the Democratic side. A number of them passed and are over to the Senate. I'm not entirely sure what the chances are of those passing, but hopefully they're small. In any event, don't want to take up too much time in the meeting. Happy to answer questions. Reach out to my office anytime if you'd like kind of more detailed updates. And thanks, everyone.
Thank you so much. Thank you for being here, and thank you for all the work you're doing there. So we're not going to have the updates that we typically have in our coalition meetings, but they have been sent to the email list. So if you haven't if you would, you can see there is a list on the agenda, and then the updates are in the email. We will, we've had a change in the 505 West Chapel Hill Street. Would you like to say a word about that and about our June meeting, Webb?
Yes. The 505 is the old police headquarters. Many of y'all are very familiar with that, and it's been a multi-year process that the coalition and CAN and the Duke Memorial Methodist and folks have in the community have worked on, trying to ensure that substantial public housing, substantial affordable housing was going to be a component of that. And we were really happy when it seemed like that was the case and a developer team was selected and moving forward. But after a year and a quarter to a year and a half, the lead developer, the commercial developer, came back saying they needed changes. The council in the last few weeks said, we don't go along with that, and we're going to begin the procurement or search process again to find another development team to move forward with it. So all of you all that have been working on this, we may need to gird back up and do some work and organizing around it. But I feel like this council has been very supportive of the substantial 80 units of affordable housing, affordable in perpetuity forever kind of commitment we had. So hopefully that'll still be a part of it. So Becky, thank you for helping me remember that. And I do think Jim Savara, you were maybe going to get to Jim, has some potential good news that you may want to let him say a word about.
Webb, thanks for that. Yes, let me just quickly encourage everybody to look at the announcement for the meeting. Durham County is developing a proposal for the property tax subsidy program. Big change from their approach last year. This would again cover up to half of the property tax bill for residents with income up to 30% of area median income who have lived in their homes for 10 years. The limit on the grant would be $750. But there'll be a meeting this week of the Social Services Department Committee, and at the Policy Committee meeting next week, we'll talk about the proposal and whether there are any suggestions we want to make about it.
Thank you, Jim. And thank you, Mr. Scott, for being with us again and for answering another 50 or so more questions. And I think that we're making some progress with the residents. I think you've put out that we've learned some things that you need some help in community in organizing the resident council. And there's certainly people on this call that can get busy on working on that, I think. And then also on the issue of skills assessment, I think that people here probably have something to offer there. And it's a tough problem. We have a lot of tough problems with the conditions of the housing authority buildings and the administrative issues of communications and work order management and all that stuff. The community, I think, as a whole is very committed to making it work and making the Durham Housing Authority succeed, and doing as much with what resources we have as we possibly can for the huge number of families who can't make it or having a terrible time making it in this housing cost situation that we have. And also, I really want to thank, of course, Representative Hawkins has left, but we thank him and Larissa Seibel, who did a great job of making sure all the questions got attended to. And you will find a recording of this of the meeting. I think you can get it through Facebook. I send it out through the I'll send you out a link to our YouTube channel for the coalition if you're on our email list. And we appreciate your coming today and look forward to working with you in the future. So thank you very much and goodbye. Enjoy the rest of your day.
Thank you, everyone.